Okay, I'll call the meeting to order at 6 o'clock. Perfect. Let's see. For the 3 board members, Dr. Meikle cannot make the meeting, so it's myself, Rich Day, and William Sanowski is on. Bill, is that you?
That's me.
That's you. Okay, great. So we're officially on June 7th, 2021. Chelmsford Board of Health meeting. First order of business is approval of the May 3rd, 2021 minutes. So, Bill, have you looked at them? I've reviewed them.
I took a look at them. So I'd like to make a motion to approve the minutes as written.
Okay, I'll second. And all in favor? Aye.
Aye.
Okay, unanimous. Okay, thank you.
Okay.
All right, next, correspondence, incoming. Sue, why don't you run down through the list and tell us what's new and what's not new, I guess would be the quickest way to work our way through it.
So we have basically, and I believe they're in order in your packets as well.
Okay.
We have the information from DEP regarding the contingency plan for 189 Chelmsford Street, which was the Shell retail station. And it's just an email, a letter updating all of us that what they're doing and how the remediation will continue. So it's just an FYI.
Okay.
And the next one has to do with the North Fire Station with 35 Princeton Street. And as we know, they are building a new fire station. So this is the paperwork that basically is the abatement services that they did to the old fire station before the work came in, and everything, of course, they did according to all of the DEP requirements.
Okay.
The next one is the release notification for 41 to 44 Central Square and the 1 to 5 Billrica Road. Basically same thing. It's an update on the mass contingency plan submitted by Ransom Consulting. And that basically involves, like care cleaners located within that time frame and what they're doing to remediate a spill there in the past. So these are just all, these are updates. These are not new bills.
Great.
The next one is, if you recall a few months back, when they came to us regarding the development of 314 Dunstable Road with a 6-lot subdivision, we had requested that they do a 21E because, years ago, this property was used as a dump, essentially, is what we were told, and a junkyard, if you will. And so the 21E report is like 300 and some odd pages. So this was the key highlights and summaries of the 21E. So they didn't really come up with or flag anything for us in this 21E that we would be considered to be really crucial. However, just as an update, since this 21E report came in, they were doing some on-site testing over there for the installation of the future installation of the septic systems. And there was a petroleum odor at one of the sites. So I did contact the engineer and asked that more soil testing be conducted. And I thought we were in the process of doing that last week. And then we were informed by the property owner that basically the property owner forbid to allow anybody on the property or doing any further digging unless the owner was present. So the soil testing that Dan was involved with for the 2 final plots last week the last one was never completed because they had to leave. And basically everything's on hold. I have not heard from the engineer. I did check with the building department to see where they were, and they do not have any building permits for that issued as of yet. So they will have to connect with us before they move forward. And then Dan had submitted an email to them too about some of the concerns that he found on the property when he was out there doing the testing.
Okay, great. Thank you.
The next one is the monthly letter that we get from Mass Mosquito Control, Central Mass Mosquito Control, telling us what dates they're going to be in the area to do mosquito spraying in Chelmsford. And when we do get these, we do post these on our website as well. The next one is copy of the invoice from Action King Services. So we are still getting copies of these from Tropical Smoothies every month. And then the final two are basically, we had issued violation tickets to UPS on two separate, well, we ended up we had issued 4 of them. The final 2 that we issued on these last 2 ticket dates, April 27th and April 28th, for non-compliance with the mask wearing, of course, all before COVID. And they were witnessed by Donna on an on-site visit, but UPS is now submitted a request for a hearing in court for the last 2 tickets. So for this one on the 27th for a total of $1,500, and on the 28th, that one was a total of $1,800. So those have been filed in the courts for an appeal. So that's the incoming.
Okay. Any questions on any of those incoming? Am I getting feedback? Bill, do you have any questions?
No, no questions.
Okay. Do you want to make a motion to accept the incoming correspondence?
Yes, motion to accept the incoming correspondence.
Okay, I'll second it. And then all in favor?
Aye.
Aye. Aye. Unanimous. Okay, thank you. All right, next,
The next,
outgoing correspondence.
yeah, quite a bit.
Yeah,
this
yeah.
month. But mainly because if you look at it, the first, several are all out of appeals. So
Okay.
it was essentially a whole lot of different variances for different things. The first one, Billrica Road and Central Square, they came forth with a different approval plan because the one that they had originally wanted, a lot of people came forward and basically voiced their concerns about it. So they changed it, and it's now the reuse and redevelopment of the old Oddfellows Hall. So they're talking about 8 apartment buildings and an 8-seat and a 100-seat restaurant. So that was just an update to the original plan for that. Biscayne Drive was just a variance for a 2-car garage. Then a 3-season porch at Indian Drive. So then we had Second Lynn and Hart Pond. Dominic Drive, that was a sunroom that didn't meet the setbacks. Mill Road was a in-law apartment. Westford Road was a storage room on the back of the garage. Dalton Road, an addition that did not, again, meet the setbacks. Park Road, an in-law apartment. And none of these had any reason for me to make any comments.
Okay. Are all of them sewered? And
Yes,
so there's no issues in regards to septic versus sewer. Okay, so they're all going to be sewered in relationship to what they're doing. Okay.
yep. So that's actually, it's interesting that you bring that up, Rich, because that obviously, as you know, that was not something that we had to kind of look into for quite some time.
Yeah.
And now when I get these things coming forward to me, the first thing I now have to make sure I make a priority is, okay, well, are they sewered or are they not? Because if they're not, then we know that that's going to trigger on-site septic.
Okay. Okay.
And then we have a letter that Donna issued to the owner of 30 Highland Avenue Is it a two-family, Donna, I think? Yeah, two-family. We got a complaint about trash out on the curb, and it's a rental property, so the owner is not on site. So we did send a letter to the owner, and then I think it was almost a week later, the complainant called and complained again. We hadn't heard anything back yet from the owner, so we also sent a letter, and Donna put a contact card on the property for them to call us to let them know that, based on our trash regulations, they can't just put all kinds of trash out on the curb and leave it there for weeks at a time. And as far as I know, we haven't heard from anybody yet.
Okay. Thanks.
And then the next one is the email that I sent to Doug Hausler on 5/3, which was after our last meeting, regarding the variance that we had passed at last month's meeting for tropical smoothie.
Okay.
So that is all of the outgoing correspondence.
Okay. All right. And we haven't got any real direct feedback from the property about them doing any of the things that we suggested?
Nope.
No, nothing. Zero. Okay. All right. Well, we'll talk about them later at later points in time. Particularly about some of the other emails. Okay, so I guess we're done with them. So same thing. Do we have a motion to accept the outgoing correspondence, Bill?
Yep, motion to accept the outgoing correspondence.
Okay, and I'll second that. All in favor? Aye.
Aye.
Okay, unanimous. All right, thank you. All right. So we're all the way down to old business. I guess COVID as usual.
So our COVID updates, as most people know, as of May 29th, the governor pretty much lifted all of the restrictions across the board, except for in, medical practices and office buildings where, there still is a requirement for wearing a mask. But we've received a lot of phone calls in the office, a lot of phone calls, a lot of emails asking if the town of Chelmsford, if the Board of Health was going to actually go stricter than the state as far as mask mandates and that. And we are not. We're going strictly by what DPH has recommended. So anything that DPH has recommended as far as mask wearing and social distancing is what we are also supporting in the Board of Health office. So we do have signs up. We updated the signs in the building. If you are unvaccinated, then you should be wearing a mask. If you're an employee and you're unvaccinated, you should be wearing a mask as well. And then, of course, we know that hospitals, doctor's office, et cetera, they are still requiring masks. Our numbers in Chelmsford, knock on wood, have been incredibly low. We actually, last Thursday, with the most recent update for the state, we were in gray color. I don't remember that we were ever in gray. And gray basically means less than 10 cases in 2 weeks. And when we did our case count of active cases last Thursday, we only had 4 active cases at that time. So, and then the most recent thing that they did too, the state, is they updated the close contact guidance so that if you are identified as a close contact of a confirmed case who was symptomatic, but your contact was outside, if you're outside with someone, you're no longer considered a close contact. So that's a good thing. And I believe that the hospitals are trending well too, as far as their cases. Lowell General Hospital has shut down their big, huge building there on the boulevard, and they're transitioning. So they haven't stopped the clinic. They're just temporarily, they're no longer going to be in that large building, and they're moving it to the 4th floor of SAIT's campus. And I believe it's the week of the 13th, 14th in that area that they will open up over there. And then after last meeting, we had the discussion regarding the article for town meeting regarding the marijuana and the updates on that. And that is just a copy of the letter based on our last meeting that was sent to both the planning board and the select board. I have not received any feedback from either board regarding the letter, although Dr. Meikle and I did participate in the select board meeting on, I think it was May 10th. So we were on that meeting, and he did voice, information about the discussion from the health department. So they did acknowledge getting this letter, but I have not heard from anyone from the planning board regarding receipt of the letter.
Okay. All right. Thanks.
Right. And that brings us to the discussion regarding rescinding Chapter 201, the Board of Health Regulation, Article 6, Subsurface Sewage and Wastewater Disposal. As we're continuing to move forward with our experience that we're dealing with, on-site septic system, which of course, like I said earlier, we haven't done in so many years, we're finding that certain areas of different regulations may need to be addressed as we move forward. And one of the things that we were discussing is this particular regulation, 201-24. So Rich, we can talk about the specific sections of this regulation that we would like to delete. And, because I know we had some discussion about rescinding the entire regulation.
Right.
And I think we had some miscommunication about rescinding the entire regulation versus your concerns about keeping certain sections. So I know you had said you were willing to recommend rescinding a certain part of 201-24.
Right. I mean, basically, clearly in the discussion that we had specifically on that, the issue of the minimum thing and the distances and the cutoff rates and the dates for holding testing and whatever, Title V has changed, and they're reasonable enough to the fact of why have something that's slightly conflicting with it and then creating some friction on that kind of thing. So clearly A through D could be stricken automatically. The only one that we had talked about keeping was the fact is that we had, as we talked in other circumstances, the external grease trap for all the food establishments in town. We want that to remain, whether it stays here, but I think right for now, I guess it would stay here, and it just would become just the one thing, and everything else would go to figure out whether we can find a better way to discuss about how we're going to do grease traps. But for right now, the external grease trap for everybody has been a policy for the last, say, 40 years. And bottom line is 99.9% of up there is in compliance with that. And we're just dealing with new facilities and or some retrofits or changes of kinds of things and whatever kind of thing. So I would make a motion at this point, or have Bill make a motion at this time, to 201-24 to eliminate A, B, C, and D, and keep E and renumber it, I guess, whatever is appropriate to renumber it, and at least get that part resolved. And then the groundwater protection, which has conflicting things with some other regulations that we have in the planning board and other things have, we're going to have to figure out a little bit better. And again, I think we got to go back to the fact that when we put this all in play in the mid 80s, the fact was that we then had a large number of commercial and multi-unit residential things come through the process. They all installed secondary treatment, which is what we were looking for that protection of the groundwater until we got 100% sewered. And we thought that this whole thing would just end at the 100% sewered. And of course, now we're in the circumstances that we're in now. So bottom line is that we had all these places go through this thing, put treatment plants in, operated them for multiple years and whatever. And then when they got the opportunity to jump on the central sewer, they did it. Now we potentially have some new ones coming through. Now, again, this is only to deal with those sections of town that are related to the groundwater protection zones and aquifer protection zones kind of thing. The rest of the town is going to be straightforward, with Title V, with some kind of modifications. If as you always get into, is a line on a map a perfect line? And if you stand on the line and on one side is it very pervious materials, and on the other side it isn't, kind of thing. So you have to have a little bit of flexibility, but overall the idea is that I think we're going to have to keep them right there for now until we have some further review of what's going to go. I think from the previous meetings, going back to us revising back in, what was it, January? I'm blanking the date.
Mhm.
The 111 in the previous months and whatever. We weren't very happy with the direction of the town, in that the plan for the town was 100% sewer, and we weren't going to have to deal with any issues of permanently protecting our groundwater supply, because everybody's going to be on central sewer. And now there's been this, let's put it this way. I'll say it, I think there was some poor planning and redevelopment in regards to allowing redevelopment to occur where the use in the necessity of additional capacity for pieces of property just went on and on and on, where something that was using 1,000 gallons of capacity then got approved for 100 times that, and project after project after project redeveloped land not in line with what we had and what the planning and the master plan, all the other good things that we presumably put together to see where the town was going to be. And they just threw that all to the side, and it just, developed. And all of a sudden now we're out of capacity, and we had just got to jump back to go all the way back to septic only kind of thing. And of course the treatment issue of protecting the water till we get, I think the intent is to get future capacity so that we do end up with the final thing that the town is 100% sewered and that all our groundwater is protected. So I would say that, we're going to leave that in play, and at least tonight, I'd be looking for Bill to make a motion to for 201-24 to eliminate
So,
A,
Rick,
B,
can
C, and
I
D.
interrupt you for one
Yes,
second?
go ahead. I'm sorry.
Before we make the motion, I just want to make sure that we don't feel that there's any need to discuss the 201-25, whatever, right now. So you're saying that because based on and I know that we had asked Dan Ottenheimer
Yes.
to be here originally, based
Right.
as part of our discussion was that some of this was in fact covered by the Title V.
And clearly what we're looking at is that in these groundwater protection zones, or whatever you want to call zone 2s, et cetera, that it's all based on the state steps in when anything's over 10,000 gallons a day. And the town has control over what's under. So therefore, if projects come forward and they exceed that capacity, then we know where it's going, and we know generally what the state does in regards to it. I think historically we had problems where developers, 30 plus years ago, were playing what I call subdivision games of breaking up property and keeping things under certain numbers so that it wouldn't trigger kind of state review kind of thing. And some of it slipped through, and the state sort of caught up with that kind of thing. Bottom line is that we're not going to be interfering, quote unquote, with the fact that, but again, the issue is that, and personally, I think they're going to be that the redevelopment of land for multiple times of what that land was approved for in capacity is the issue. And yes, the Board of Health is sort of getting in the middle of the fact that, we were going the sewer route and that was going to be the end of the issue, and no one, and everybody did it. Everybody jumped on the bandwagon to protect the groundwater of the town over the 30 years that the sewer project was going through, and put in their treatment plants. Didn't fight the town in regards to our right to protect the groundwater in those areas that potentially might need protecting, and not just for those that are over 10,000. Now, again, a lot of the projects that came forward were over 10,000, and they did go to the state, and there wasn't a lot of issues that we dealt with individually for smaller scales, but there were a few. There were a few that were on that edge of being under the 10,000 that did go forward and do some level of treatment to what I basically call protect the water supplies of the town until the town straightens out their issue to do its sewer, and we finish what the town voted for. I mean, the town voted for 100% sewer. They didn't vote for something else. They didn't
So I
vote
guess
for-
I guess I would just say that when you
Go ahead.
make your motion,
Yes.
because we're it's what you're proposing is to delete A through D. That
Right.
included in your motion, we delete A through D, but then switch E to A.
Yes. I'm sorry. Yes. Okay. Yeah. And Bill can do it that way. Yeah. That sounds perfectly fine, and we'll go
Now,
forward with the
now
other.
you have to make that official motion.
All right. Bill has to make
Can
the
I-
motion. Go ahead.
Dan?
Mr. Chairman, can I just share some insight that might help the board?
Yes. Go ahead.
Can you hear me? Are the
Yes.
acoustics okay?
Yes.
So section E on grease traps, that is also covered in Title V. It's in section 230 of Title V.
Right.
So a grease trap is already required
Right.
on any engineering drawing for a food service establishment. So
Right.
I'm
the
not
issue
sure
is-
you need,
Well, the issue always has been that by us putting in the word all, it again, there's a lot of squabbling that goes on in regards to at what point, depending on the waste stream that might be generated by the potential thing, that they're coming in, sitting there saying, well, we don't need it, but the other ones do, kind of thing. Title V is not so, I mean, it's general wording that I think that you can interpret that way. But again, as I said, I think the grease trap thing needs to be looked at a little bit, because I know some communities have done, a lot of other work to entertain, to deal with what you call entities that don't generate the kind of waste stream that may be of issue that the external grease trap does. Yeah, you're absolutely right. And that's the way I interpret it too, but Title V. But I think the word all here kind of clarifies our position, what our position has been, okay, and also too the position of being a previous sewer commission for 25 years, that the fact is that the sewer project was clearly, in support of the fact that, all facilities, when they're built, they have this exterior grease trap. And if they don't generate a lot of stuff, then it doesn't have to be maintained as often, et cetera, and the cost of whatever they are. But when the next facility, and that's been the problem, change of menu and change of facility ownership to something else, now you got this fixed facility with an improper infrastructure, and now you got to tear the whole place up and do it whatever. I think our attitude has been, if you got a building, particularly if it's an existing building, you put in the infrastructure for a place once, and then it's done. So I don't disagree with you, okay? I don't disagree with you, but I think the word all, I think, is a little bit stronger than the way Title V words it. So, all right. So, I mean, as I said, I don't disagree with you, and I interpret it the same way. But I think when we did it, we put it all so that we wouldn't be fighting constantly over every menu and every item that comes down the pike, kind of thing. And it's kind of, what I call a burden, okay, on everybody to constantly, and also too, to babysit, if you want to call it that, every time someone does something and change and whatever kind of thing. You put a reasonable sized grease trap in outside, and I mean, I don't want any business to go out, but regretfully, you know, they rotate through. The next one comes through and it's pre-set up and on they go. So I think overall at the end, it's a more trouble-free thing. And I think all, at least from right now, is good. And I think maybe we'll do some more review of grease trap regulations around the state. As I said, I know the town, particularly with the sewer commission, clearly didn't want to repeat. I mean, I hate to put it that way, didn't want to repeat the mistakes. I mean, we have a sewer system that's now, let's say, 35 years old. And while most towns out there have systems that are 10 times that, no, not 10 times, I'm sorry, but basically going back, 100 plus years kind of thing. And it's very hard to switch in gear in midstream when you already let, 100 years of history allowed everybody just to connect in, and sorry, the town has to deal with the problems once it gets out in the pipes kind of thing. So the town says, why should we deal with it? Why should we pay for it? Let's have everybody do it. And the answer was, oh, well, our regulation says all, so everybody's happy. And then of course, things pop up and you got to deal with it again. So, but I do agree with what you said, Dan. And I agree with your interpretation of it, but it has popped up, and I think the word all kind of cements it.
Yeah,
so.
That's fine.
All
You're
right.
the policy
All
making
right.
board. I just wanted to make sure you were aware of how it was written in the
Yes.
state code, and I agree, it is differently worded than what you have in section E.
Right. And as I said, I think it just gives us a clearer picture to it and go from there. So, all right. So we got to go back to, thank you again, Dan. Go back to Bill. You want to make the motion?
I'll make a motion that under 201-24, items A, B, C, and D be eliminated, and we keep E.
And to change E to A. Is that what you
That's
said,
Yep.
Sue?
Okay.
Okay. I'll second that motion.
All right.
All in favor? Aye. Okay. Unanimous. All right. Super. Thank you. Thanks. Thank you, Dan.
So are you going to discuss section 25 as well? Because there are some items in there that I think need some attention. It may not need to.
The answer is yes. I mean, one of the things that we've tried to do because of the fact that we're a small board, okay, and you always like an odd number of members if you're going to be reviewing something and potentially voting on something, that you just don't create stalemate kind of thing. Potentially that way. I'm not saying that, but so I would say until it was a full board. I think yes. I think we're gonna come back to it. Yes.
So on behalf of your staff, I do have an engineer that's been asking questions and looking for guidance on how to interpret section 25.
Okay, well,
and I don't know how to advise them.
Well, again, as I said, I think if you want tomorrow or whatever, we can have a discussion of where things were. Okay, and what we've done for 30 years in regards to the interpretation that's there, okay, to it, and that's all I can do is give you the best past thing until we do look at it a little bit harder and whatever. But as I said, the board I think was pretty strong in the fact that it was not going back to the fact that for the 0 to under 10,000 that we're just automatically in these protection zones, just going to go back to straight septic. That there had to be something done additional, some kind of secondary treatment additional to improve things. So if you want to call tomorrow or whatever, I mean, you probably have some more specifics that you want to talk about. So.
No, the engineer has asked me what do I do on two particular points. How do I know if my property is in the water resource zones that are indicated on here, and what
Okay.
does the board mean with respect to secondary treatment?
Okay.
So they're
Yep.
looking for guidance.
Okay. No, no,
I don't have
absolutely.
information to give it to them.
Okay. Okay. All right. Well, as I said, we can definitely do that. We can definitely do that, and I can get back to you on it.
Okay.
So Dan,
So I'll let them know. Okay.
Dan, can I just ask you a question? Are you asking for more information beyond the definition of what secondary treatment is in this, in the regulation?
Yes, correct. Because in the eyes of DEP, they have approved treatment plants that provide a secondary level of treatment. They've also approved intricate leaching fields that also provide a secondary quality level of treatment. So it's not.
So yeah,
clear.
no, just interject. The answer is, as usual, the answer is the scope and size of the project and its location in regards to where they are in the groundwater protection. I mean, a good example is that, you know, you could be right out just outside the zone 1 in your zone 2, or you can be on the exterior fringe of your zone 2. And it could be a project that's a few thousand gallons of capacity versus one that's 9,500 kind of thing. And clearly, I think that the board is looking for, because of all these different, you know, technologies that are available, that there be a sliding scale in relationship to the impact that this particular project and what it is and its size is in relationship to, you know, municipal water supplies that say exist, kind of thing. And that, yes, those other type of treatments that are there that are particularly sort of aimed at this smaller flows that you're talking about, versus, like you said, the full blown, secondary, tertiary treatment plant kinds of things. Yes, I think a number of those kinds of technologies clearly would be something that we would look at and depending on the circumstances, approve or disapprove, in category, not one specific, type over another kind of thing, but in the different categories that they have out there now, which didn't exist before. I think, so it's not this cut and dry. If you have to have treatment, it has to be, a full blown rotating, treatment plant, versus it's a small scale thing, which basically a number of single family homes down the Cape have, and I'm using the Cape because of course that's where a lot of this stuff came from, are putting in some of these other technologies that, nitrate reduce and this, that, and whatever kind of thing. And those kinds of things definitely would be on the table, okay, in which to look at and review and sit there and say, yeah, that type for your circumstances, your scope of project and whatever, and its relationship to, the municipal water supplies and whatever. Sure.
So then I would encourage the board to make it clear to an applicant by revising the regulations with specifically what you're seeking, rather than they go ahead and engineer something and appear before the board, and then you say, no, that's not what we had in mind, because then it's a considerable expense.
Okay. Well, as I said, if you want, we can have a quick discussion about, how to approach, doing that and making that change. But as I said, I think we're not looking to be unreasonable, and never have during the 30 years in which all these treatment plants and other things. I mean, the large size projects that kicked over to the state were no brainers, but some of the other small ones that were on the smaller scale and whatever were the ones that you sort of, well, what about this and where are they? And let's say their point of discharge is where, it goes right directly into a brook upstream of a municipal well field, versus they're on the groundwater protection zone, 3,000 feet away, kind of thing. And there's not a lot of high velocity flows from that area, being recharged to the wells and whatever kind of thing. So you're right. I think with a little bit of work, we can kind of come back with what I call that kind of scale scenario that would be, acceptable, but particularly on this, particularly up front on what I call the smaller side of things. Okay. Say the under 1,000 gallon or under 2,000 gallon kind of operations.
Okay, so can we
Yeah.
make
Yeah.
that maybe one of the goals to try to come up with some clarification on that for
Sure.
the July meeting?
Yeah.
Okay, so right now, we're just going with the original motion of 201-4 deleting A, B, C, D.
Okay.
Okay. All right, so that actually concludes old business.
All right.
And thank you very much. I appreciate you taking time to come onto the call.
Yeah.
And I'm sure
Of
you'll have,
course, I'm here.
you'll be able to have a discussion with Rich about some of the clarifications.
Yeah, I'm here to help the board and the health department in any way I can.
Thank you.
Thanks, Dan. Appreciate
Of
it.
course.
All right. Do we need a vote on the old business? Have we usually do that?
Yeah,
Okay. Bill.
Motion to accept the old business?
Okay. Second. All in favor?
Aye.
Aye. Okay. Unanimous. Thank you.
so now we have new
All
business.
right. Next, new business. Yes.
I feel like every time I turn around, we're needing to clarify our fee schedule, but it's just with all the different changes, and we're transitioning in the department to our online permitting. And so as we're doing that, we're finding other things that have come up. But we recently were reviewing the fee schedule, and we have a body art establishment in town that wants to bring in apprentices, and we realized that we did not have anything on our fee schedule for an apprentice. So we did do some research
Okay.
of surrounding communities, and basically we would like to ask the board to approve that we add body art apprentice permit to our fee schedule for $250 a year.
What do you think, Bill?
Yeah, I make a motion to approve it.
All right. I'll second that. All in favor?
Aye.
Aye. Unanimous. Thank you.
The next two things under new business, every year, we have a lifeguard regulation on the books. And the town of Chelmsford basically several years ago came up with a regulation that required public and semi-public pools to have lifeguards on duty whenever they were open to the public. However, there was a provision for a variance under certain circumstances, and if these pools provided information to us that could let us basically make the determination that the pool was just as safe because the numbers were low. So each year, Williamsburg condominiums number 1, Hitching Post condominiums, so they both have submitted applications to us. Now, neither of these pools were open last summer because of COVID. So one of the requirements is that they submit to us 8 weeks of logs of their chemical testing and maximum pool bather load and all of that. So we do have all of those documents from 2019, which they all fell into compliance, and they provided us with what they needed. So basically, after reviewing all of the documentation submitted by Williamsburg condominium number 1 section, they have 2 pools, and then the Hitch and Post condos, I would recommend that the board vote to grant a lifeguard variance to each of them. but I think you need to do it in 2 separate votes.
Okay. All right. Ready, Bill?
Yep, you got a motion to grant Williamsburg, I guess what,
It's basically a weekday lifeguard variance bill so that they don't have to have
Okay.
lifeguards Monday through Friday. They still have to have them weekends and holidays.
Okay, so granted a weekday variance to Williamsburg. Motion.
Okay. Okay. I'll second that.
Okay,
All in favor?
Aye.
Aye. Okay. Unanimous. Okay.
Okay, another motion is to grant the same thing for Hitching Post condominiums, Monday through Friday variance on the lifeguards.
Okay. I'll second that. All in favor?
Aye.
Aye. Okay.
Okay. And now you just need a vote to accept new business.
All right.
We got a motion to accept the new business.
Okay. I'll second that. All in favor?
Aye.
Aye. Okay.
Next on the agenda is the reports.
Okay.
And we have implemented back in the office. Now we have reinstituted our weekly meetings to try to get everybody to meet once a week to keep everybody, on the same page and informed on, what's happening. Now that we have seen our COVID numbers go down, and that has alleviated some of the stress on the staff, we can now try to go back to some of our normal Board of Health duties. Donna is concentrating on going out and doing all of the site visits for all of the small animal permits that have been renewed. And we're back to trying to catch up on, restaurant, food establishment inspections each week. We did just last week. We did go live for our online permitting system. So now anybody who is requesting a permit through the Board of Health now applies online. And Donna has been the champion of that. She helped coordinate everything and get us moving. It was a ton of work, a lot of hours, a lot of headache, trying to make sure that everything was, up to par to make a smooth transition. It is going to be a transition for a lot of people because obviously we've never done it before. They're used to receiving, paper copies of applications and or email notification. They'll still get email notification, and it's a nice system where we can send out bulk emails when it's time to renew, depending on what type of permit it is. So once we really get the hang of it and once everybody gets trained, and Donna has taken on that responsibility because she was in charge of coordinating it and kind of helping us launch it. She's also taking the lead on training others in the department on how to use it. We do have tablets. We're waiting for them to upload the software, tell us what software to put on the tablet so that those can be taken in the field. And when they're doing inspections in the field, they'll all be able to be logged right on the tablet. So it should hopefully streamline things for us and help us get more organized. The food establishments that we're trying to catch up on, we're just kind of going by the list of the ones that were done, the longest time, if you will, and trying to get those done first. And in between, dealing with, the typical complaints that we get in the springtime.
Okay. All right, great. All right. Do we usually take a vote on others? I don't remember.
Yeah.
We do. Okay, Bill.
I got a motion to approve others.
Okay, I'll second that. All in favor?
Aye.
Aye. All right, public input. I don't know. Let's see, I don't
We do
see
have
anybody, but
People on there. I see a John on there. Darcy is on there, and I see Nancy Arroway. I don't know if any of them wish to speak.
okay.
If any of you wish to speak, you can unmute your microphone. Okay.
I don't see anything, so,
Nope, doesn't appear like anybody wants to speak, so that would,
all right. So I'll close the public input section.
yep.
Okay,
And our next scheduled meeting is July 12th, which
Okay.
typically we meet the first Monday of the month, but the first Monday is July 5th, so it's a holiday. So
Okay.
we meet July 12th. And at that point, we are back to in-person meetings
Okay.
at 6 o'clock. We have not determined what room that will be located in yet, but we are in the process of trying to secure that room, and we'll let you know.
Okay. All right. All right, well, I thank you all for being there, and
Need a motion to
Bill?
adjourn.
Get a motion to adjourn?
Okay, I'll second that. All in favor? Aye, all right. All right, but thank you all, and hopefully Dr. Meekel's issues are not that problematic, and we'll be back for July and go forward. And as I said, I'm assuming I might have Dan's phone numbers and things, but I'm not sure.
If not, we can send them to you.
Okay. I have to look around, see it's sitting there, kind of thing. So,
Let me know if
But-
you have it, and if you don't, I'll send it to you.
okay, thanks.
All right, thank you,
All right,
everyone.
thank you, everybody. Thanks, Bill.
Yeah.
Thanks,
Okay.
everybody. Bye.